Hi ladies, welcome to Kalosa Gynae channel, which is the place to discuss all about the things related to female reproductive health. I'm Dr. Deepti Asthana, Director at Kalosa Clinic, and I'm Senior Consultant Obs and Gynae in Fortis Hospital, Gurgaon. Now, the moment you discover you are pregnant, it brings new meaning to your life. The feeling of carrying a soul within you is magnificent, isn't it? To prevent you from running from grandma to Google, I thought of providing genuine information to everyone out there who's trying for pregnancy or has just become pregnant. This video is one of the most important videos in pregnancy series, so please stay connected till the end and understand how to manage the initial months of pregnancy. You can also log into my website www.drdeeptiasthana.com for more information and subscribe my channel Kalosa Gynae for regular gynae updates. Now, pregnancy journey is not so easy always, but definitely worth it. I really want all of you to enjoy your pregnancy journey and remember it as the most memorable moment of your life. All the patients coming to me already know my approach towards pregnant patients, and many of the things I'll be talking about here through this video is also for those who are not able to reach me. I want all the women to embrace motherhood with confidence. Books, websites, and people should make you feel good about your pregnancy, but not overwhelm you or make you feel scared or underqualified. Now, a full-time pregnancy has 3 trimesters and lasts around 40 weeks, starting from the first day of your last menstrual period. We divide these 40 weeks into 3 trimesters. 0 to 12 weeks is the first trimester, second is from 13 to 28 weeks, and third is from 29 to 40 weeks. In each trimester, the fetus meets specific developmental milestones. Some people also talk about a 4th trimester, which is a 3-month transitional period after delivery. In this video, we'll be talking exclusively about the first trimester. Now, the first trimester is the first 12 weeks of the pregnancy, and it is definitely a crucial time for fetal development. Especially 5 weeks to 8 weeks. This is the teratogenic period, which means you have to avoid any dangerous medicine or food which can result in fetal organ malformation. Hence, it is always important to see your doctor at the earliest for proper guidance. Developmentally, if we see, by the end of first 12 weeks, all the body's major organs of the fetus and structures, they have begun to develop. The heart is beating regularly, finger and toes have formed. The fetus is around 3 inches long and weighs nearly 1 ounce, which is roughly 50 grams only. The nerves and muscles, they work together and the fetus can make a fist. The eyelids have formed but will remain closed until around 28 weeks to protect the eyes. Now, if we see the mother, the most significant changes start occurring in a pregnant female from the first trimester itself. This is the first time for sudden increase of pregnancy hormones, and many other changes occur in the body because of that. This is a transition from non-pregnant to pregnant state. Self-care is important, and I also think having a supportive partner is equally important. So this is a message for all the husbands. Please support your wife for next 9 months. These are difficult times for her alone, so please give her full support and care. And believe me, that means a lot to her. Now let us see what are the changes that you can expect in the first trimester of pregnancy. Nausea and vomiting. These are the most common symptoms of pregnancy. Now every pregnancy is different. Some can have no nausea at all, whereas many have characteristic morning sickness. Others may experience nausea throughout the day, and also some experience little serious condition called hyperemesis gravidarum, for which you may require short hospitalization, also for fluid replacement. Now, the trick to control nausea is to start tablet doxynate prescribed by your doctor. You should have short, frequent meals and avoid long hours of hunger. Late dinners are complete no. They have to be avoided completely. It is advisable to have something dry like dry toast or rusk or dry biscuit before brushing your teeth. Some people feel better after having ginger biscuit or raisins or kishmish or kachi nariyal. That is for you to discover what suits you the best. You have to keep testing what is best working for you. As I told you, every pregnant patient is different. Now, there can be heightened sense of smell also. You may suddenly develop aversion to some food due to their smell. They may be your favorite food before. This may continue for a few weeks, and so there is no compulsion to have food which is making you sick. Take it easy, switch to foods which make you comfortable, and of course, homemade and healthy. Now, another set of symptoms which is most common is lethargy and fatigue. You may be resting at home, but still you will feel very lethargic. Now, something is going on inside your body which is draining your energy. So, all pregnant females, as I say, be kind to yourself. Take that extra nap instead of brushing up on baby sign language. Don't push your body. Take intermittent breaks if you're feeling too tired. Now, you can also have tender swollen breast. These may be the first sign for those who are not expecting pregnancy because of irregular menses. Now, nothing major to be done for this, but do increase size of your innerwears. Some people can have various mood changes. Now, these are also not uncommon, but partners, please stop blaming your wife for this. A lot of hormonal changes are going on inside her body. So, she may have this. Please make her comfortable and be cooperative. And for ladies, please take deep breaths and control your emotions. Nothing else really matters at this moment of time than your pregnancy. Now, you can also have cravings for certain foods. Some people have cravings for some food while aversion for others. It is perfectly fine. Eat a chocolate if you really crave for one. Try to switch to home-cooked foods, and ever you need to eat from outside, please avoid eating anything raw. Raw can be salads or burgers or sandwiches also. Now, the next set of symptoms is headaches. These are also common in first trimester because of the hormonal changes. Any triggering factor should be avoided, and you can rely on simple analgesics such as paracetamol to control these. Next is indigestion and acidity. Now, due to relaxed stomach sphincters, one can experience acid refluxes and heartburns. Avoid large meals and spicy meals, and do not lie supine immediately after having a meal. Late dinners are to be avoided completely. You can use antacids prescribed by your doctors to help you deal with these. Now, the need to urinate more often is also there. Now, this can be due to pressure on urinary bladder because of the growing uterus, which is right behind that. Important is to rule out any urinary tract infection, which can also cause lower abdominal pain. So please do not restrict your fluid intake because of increased frequency of urination. Rather, you should maintain an intake of at least 3 liters daily. Now, coming to next set of symptoms, which is weight changes. We do not expect major weight gain during the first trimester of pregnancy, so do not panic if you find same weight in first 2 to 3 months of the pregnancy. As I told you earlier, fetus gains only 50 grams of weight in the first trimester. So, theoretically, mothers, they gain 1 kg of weight, and some may lose also because of hyperemesis, as I just told you. So, this is all perfectly fine. Next set of symptoms is constipation. Now, due to increased progesterone hormone, gut can have reduced mobility. Ladies should increase their fiber intake. So, lots of green vegetables and fruits and plenty of water. Keep doing some physical activity and avoid complete bed rest until medically indicated. Now, one can use bulk forming laxatives if you require something for constipation. Another set of symptoms is acne and skin changes. Some patients may feel flare-up of their acne. Now this is again due to hormonal changes, but important thing to note is anti-acne medications like retinol, they are completely no in the first trimester as they can harm the growing fetus. Some hyperpigmentation of face, breast, etc. is very common and should not bother you. Now coming to some key points. First, about the medicines. The moment you discover you're pregnant, please go and meet your doctor. She'll give you a complete list of safe drugs which you use in first trimester. Mandatory medicine which has to be taken in first trimester is tablet folic acid, which is usually started from preconception period only. Do not self-medicate yourself because as I told you, there's dangerous teratogenic period involved in first trimester. Coming to food and calories, in first trimester we really do not want any weight gain, but want you to be comfortable in eating whatever you are eating. You should stick to short frequent meals. High protein diet should be preferred. Example, paneer, eggs, sprouts, bean salads, dairy products. Non-veg can be taken but should be properly cooked. Calorie intake should be 80 to 100 kilocalories only and no extra calories actually required in this trimester. It is definitely a myth that you have to eat for 2 when you're pregnant. Fruit and vegetables should be taken in 5 portions per day and try to include coconut water, which is also rich in minerals. Now, very important thing, what foods to avoid? In fruits, we always tell patients to avoid pineapple and papaya. Alcohol should be avoided in any form as it affects the development of the baby. Soft drinks as well as hard drinks, both should be avoided. You should avoid Ajinomoto, monosodium glutamate, which is commonly used in Chinese preparations, and those momos also, which you eat, those momo chutneys and all. So kindly avoid them. Vitamin A supplements should be avoided, example fish oils and liver products. Now caffeine, restrict caffeine to 200 milligrams per day, and also remember chocolates, health drinks, they also contain caffeines. Fish containing mercury should be avoided completely. Tuna, salmon, etc. should be taken not more than twice per week. Other non-veg products should always be properly cooked. Now coming to exercises, this is a very common question. Even those patients who have never exercised in their whole life, the moment they become pregnant, this is the first question they ask, what exercises are allowed? Now in first trimester of pregnancy, only deep breathing exercises and walking and stretching exercises, these are the safest things to do in the first trimester. Ladies who are not used to heavy exercises should avoid it completely. Now, what are the activities to avoid in first trimester? Long traveling by any means and intercourse should be avoided if you are a high-risk pregnancy. If essential, let your doctor assess you and take a call regarding this. Remember, pain, lower abdomen and bleeding, these are the 2 warning signs of pregnancy, and immediately consult a doctor if you think these are happening to you. Now, what are the important investigations in this period? Please, always consult a gynecologist the moment you discover you're pregnant. She'll record your history and assess if you fall in high-risk group. She'll order general blood investigations to assess your well-being. Ultrasound for cardiac activity should be done around 6 to 7 weeks. Important ultrasounds to be done at 12 weeks is level 1, which is NT scan. This detects any abnormality in growing baby's face, brain and spine and is an important tool to screen chromosomal anomalies. Also, double marker blood test is done post-scan for the same reason. Your doctor will provide more information regarding this. So friends, hope you understood how that it is better to be wise and enjoy your pregnancy rather than believe something else. It is a journey of immense joy coupled with excitement. So both the partners should cherish this. For more information, please log on to my website www.drdeeptiasthana.com and you can also subscribe my channel Kalosa Gynae. Thank you and take care.